The following program is a production of the Fairfax Network, Fairfax County Public Schools.
Welcome to Community Keynotes. Fairfax County Public Schools recently hosted a community conversation on teen stress, fostering wellness and resiliency. The event brought together more than 1,000 teens, parents, mental health providers, and educators to discuss ways to address mental health issues and the needs of students. Kim Dockery with FCPS says the summit was a way to get the conversation started on teen stress and how it can affect students.
What we hope to accomplish is to say this is a community effort. This is not just schools, not just parents, not just community providers, but it's all of us looking at this together. It's saying that we all have a role to play, and if we do tackle it as a community, we can make an impact for teen health.
The keynote speaker at the event was Dr. Brad Sachs, who is a psychologist and an author. Dr. Sachs told the audience that every teen needs to say goodbye to their adolescence in order to prepare for adulthood. Parents, he said, need to keep that loss in mind as they support the growth in their children. After the keynote, participants chose from more than 60 breakout sessions that offered resources on wellness and resiliency. One parent of a middle schooler said she attended the Teen Summit to get more information on ways to support her son.
So I want him to be not like, shutting me down for every single thing. So I wanted to get more information, learn more stuff so I can help him more. And actually I learned a lot in the very first with Mr. Sack. That told me, you have to listen to them and see what they're going through, not what you want them to be. So actually I learned a lot within like 15 minutes he talked.
Some of the breakout sessions included student-run workshops where presenters could give their perspective on stress and school. Ben, a sophomore, thinks there's more competition than ever at school.
I think the level of competition we are facing in our schools, just inside of our school community, not necessarily outside, but inside of our schools, is greater than we've ever seen. It's increasing year over year at a level that I don't think our students can keep up with. And I think we need to find ways that we can manage that. And I think that's what this whole summit is really looking at, is how we can start that dialogue on realizing that teens are facing unhealthy amounts of stress.
During the summit, participants could visit the exhibit hall to get more information on community resources. Attendees also had the chance to try a yoga class and learn how to manage stress. The community conversation on teen stress was a collaboration between the community, Fairfax County Public Schools, and Fairfax County government. Conference materials are available on the FCPS website. In addition to this valuable conversation on teen stress and mental wellness, the Fairfax High School PTSA also hosted a program on substance abuse in partnership with the nonprofit Unified Prevention Coalition of Fairfax County and its work group, Protect, parents reaching out to educate communities together. During this educational presentation, participants shared their personal stories about substance abuse, the signs and symptoms of teenage drug abuse, proactive steps parents can take, and where to locate supportive resources.
Good evening, everyone. My name is Jennifer Lewis Cooper, and I'm a member of the Unified Prevention Coalition of Fairfax County. We're a nonprofit organization, and we're dedicated to keeping youth and young adults in our community safe and drug-free. Tonight's program is Protecting Against Substance Abuse. We will hear from members of Protect, a work group under UPC, which stands for Parents Reaching Out to Educate Communities Together. This program started about 5 years ago in our county after the death of Alicia Lannis. She was a fine young woman that had addiction problems and mental health issues. She died of a heroin overdose. Her death triggered the downfall of the heroin ring that you probably all read about out in the western part of our county back in 2008 and 2009. We are here tonight to educate and make you aware of substance abuse in our community. to help you understand how it affects our young people and their families, how substance abuse can lead to the disease of addiction, and to tell you that there is no stigma attached to those with this disease. We're also going to discuss the legal consequences of substance abuse, and most importantly, offer you resources, treatment, and options, and hope. So we're going to have a panel discussion with our 4 panelists this evening. So right now I'd like to introduce our moderator. Her name is Paula King, and she's an intake officer at the juvenile court system here in Fairfax County. Paula?
Thank you. Good evening. Thank you all for coming out. I know it's very cold tonight. As Jen said, we have a great panel tonight. First, we have Lori Shapiro, who is a parent of a son in recovery. We have Sergeant Bill Fulton, who is a school resource officer coordinator for Fairfax County Police. And then we also have David Edleman, who is the clinical supervisor for Fairfax-Falls Church Community Services Board Youth and Family Team. Lori's going to start us off this evening.
Good evening. In addition to being active in the Unified Prevention Coalition, I also am a co-leader of the Northern Virginia Parent Support Group that is run by Caron, C-A-R-O-N, Foundation. There are also parent support groups in Bethesda, Maryland as well. And we've gotten we being my husband and I, have gotten very active in this area because of what happened to our son and our family through the disease of addiction. In addition to speaking through UPC, we also are active at Caron. I'm on the National Alumni Board for Caron and take phone calls from parents who need help or assistance and are looking to know what to do with their children. So we try to be grateful that our son is alive and that we've survived this so far by giving back to the community. If I think back to when our son was young, I never, ever, ever thought I would end up speaking about him being addicted to drugs. We were a family that was close-knit. We were well off. We were active in our religious organization. Our son was an athlete. He was good in school. And we always, always, always were mindful of the dangers of drugs and alcohol and the possibility for addiction. My husband worked for the Drug Enforcement Administration, whose mission is dedicated to eradicating the criminal organizations that distribute drugs outside the country and within the country. And so we were always very mindful. We took Jacob to DEA picnics where they showed you what went into meth and discussed it all the time. It was not a closed subject with us. We were always very nervous about this happening. And so we thought with all the talking we did and all the discussions and all the education that certainly our son was not going to become addicted. That happened to other families. Those were families where the parents were not good. They weren't active in their children's lives. And I'm here to tell you, if it can happen to our family, it can happen to any family. And I know many, many, many good families. In fact, most of the families where it's happened, the parents are active in their children's lives. The kids are wonderful kids who do well in school, who are athletes. Certainly none of them started out wanting to be an addict or thought that they would be an addict. But it's something that either you're genetically disposed to, and so your brain, the first time you get some alcohol or marijuana or another drug in it, your brain is automatically triggered and there's no turning back. Other kids, they go down the road and they use it, and all of a sudden they go from use to addiction. And it is a brain disease. It's not a moral failing. And so what I want to tell you is that if, God forbid, it happens to you, please seek help. Don't be ashamed. Don't be embarrassed. It is a medical condition. Now, my son's story started at the end of high school. He started, as far as we knew, was drinking some alcohol, and we thought, no big deal. This is what teens do. You know, some alcohol's not going to hurt, even though he's underage. But at the same time, what we didn't know, he was also smoking marijuana. And when he went to college, the marijuana went from, occasionally on the weekends to every day, to constantly all the time during the day. Then all he wanted to do was smoke marijuana. He would then also drink alcohol on the weekends, pass out, black out, and it quickly proceeded from an occasional use of alcohol and marijuana to constant use, to abuse. He was genetically predisposed. So the transition from use to addiction went very quickly with him, although we did not know about it at the time. He probably went from use to addiction in a period of 3 months. We were not aware at the time. At the end, his drug of choice then proceeded from marijuana to cough syrup. Cough syrup that he would put in with sodas, he would bring it to class, he would drink it, he would come to his study groups. And it did brain damage to him. Luckily, he seems to be recovering from that at this point, but it did do some brain damage that took 3 years now, where it's finally getting out of his system and his brain is starting to recover. And then also cocaine, the Molly, which is also ecstasy, but his drug of choice always was cough syrup. As with many kids who use drugs and alcohol, his use also included prescription drugs. He went on the internet, he looked for anything, he looked up everything that he could find in someone's drug cabinet. What eventually happened was he took an overdose of Xanax and a suicide attempt, which is a frequent occurrence. We've had a lot of suicides in this area, and I think if you examine what happened with those kids, you're going to frequently find that substance abuse was a factor in those kids' deaths. So what did we do? Finally, we were very, very fortunate that it came to our attention because he was pulled over for speeding. We were very fortunate that the officer was very diligent and happened to see that there was a bag in the back seat on the floor of his car that had marijuana in it. And we were fortunate that the officer asked him about it, and our son was honest, and he went to court. So at that point, we knew we had problems. And maybe other parents would think that, oh, it's just one use, it's not his, it's someone else's, we're not going to worry about this, everybody smokes marijuana, I smoked marijuana in college, so what's the big deal? Point one is, marijuana is not the same as when us adults were in college. It's very different. The potency is so much more. It's so much greater. It's at least 20 times greater now. So what your kids are smoking or ingesting through the edibles is far more potent than what you did. So it is a cause to be concerned, even with a single use, even when they're just starting out, before it becomes an addiction. So the legal system became involved, and we immediately got him into outpatient treatment at a public facility. It didn't work for him because the people involved were not teens. They weren't young adults, they were 50-year-old men and women, and that was not something he could relate to. He needed something that was going to be involving teens. So we started down that road. It didn't seem to work. We did have him in the program for several months, but it wasn't working. So then we tried private outpatient treatment. Now that one was working much better. It had a teen, what I would call AA group, and they would talk about their addiction and their issues and why they came to be where they are. That was more helpful, but Jacob was actually just too far down the road with everything else, with the cough syrup, with the marijuana, and with the cocaine and the Molly. He was just too far gone. And at that point, the wonderful, wonderful therapist said to us, it's time for residential treatment. We didn't know where to go. We had no idea, and I think that's an issue that a lot of parents have faced when they think that their kids have issues. They don't know where to turn and where to go, and I'll discuss that at the end. But we were very fortunate that we found Karen, and we put him in residential treatment. And at the same time, our family got educated about addiction, about how to be a different type of parent. You have to be a different type of parent if you want your child to recover. If you want to prevent your child from using drugs, I think you have to be a different type of parent. So he was at Karen for 4 months. Then we put him in another structured program for another 6 months up in New Haven, Connecticut. And then after that, he was in another structured program for 4 months in outside of Baltimore, Maryland. And that was more of a halfway house. And so all total, his treatment lasted well over a year. And the studies show And the reason we did this is because the studies show the more structured treatment you can give to your child, the better chances are for them to be in long-term recovery. But the impact on our family, even though we found treatment and everything was great, we had him in treatment, it was going well, we were very, very pleased with the way treatment was going, we drained my 401k. I was in private practice, I'm an attorney, gone. All that money that I'd saved up, gone to pay for treatment. Because at the time, there was no Affordable Care Act that mandated insurance pay for treatment. So we were out of luck. So did that, drained everything else, went to every resource. We were in bad shape financially. I would never change anything of it because it kept him in treatment, and I'm happy to say today he's been in recovery for 3 years. But financially, devastating. Emotionally, devastating. Embarrassment, shame. I couldn't tell my best friend that I've known for 49 years. I could not tell anyone. I couldn't look people in the eye. My husband couldn't tell people. He worked for DEA, for crying out loud. We're going to go tell people someone who worked for DEA couldn't keep a hold of his child long enough so that they would stay away from drugs. What's the matter with you parents? It was horrible. Our daughter suffered as a result. She's 7 years younger than him, and she unfortunately had to participate in all the treatment. We would go up and visit him, and because of that, her life was impacted. She wasn't able to participate in all the activities that she should have been able to participate in because we were so focused on getting him his treatment. But as I said, I feel very lucky because there's so many parents out there who've gone through this, and unfortunately their children did not make it. They died. This is a disease where there's three outcomes. There's recovery, which is wonderful, but it's still a long-term disease. So even though you're in recovery, you're not cured. So it's always going to be with you for the rest of their lives, the rest of your life as a parent. There's jail, which we know about. You violate the law, you're going to get caught eventually and go to jail. Or you're going to go to jail more often than not because you commit a crime in order to support your habit. Most people who are in jail are not in jail for possession. They're in jail because they committed either a violent crime or robbery or something like that. That's where the progression goes to. And finally, the last outcome is death. And that's the most horrible one. And we were very fortunate. Our child's still alive in recovery and did not have to do jail time. But for many other parents out there, my heart breaks for them because they were not as fortunate as we were. Not because they were not good parents, but just because the disease of addiction is that powerful. So as parents, what to look for? I want to give some tips about what to look for. You know, there's the usual that you would look for in your child's room, the lighters, the straws, the rolling papers, if you're, those kind of things. But more importantly, the more important places to look for, their computers, their tablets, their cell phones. You are the parent, look at those things. Put a software program on there so you can track where they've been. That is where you're going to find the most information, the most telling information. And when you do that, you also have to educate yourself about what terms are being used, the whole lingo nowadays. It's not just Mary Jane anymore. There's Skittles, there's Spice, there's the Molly that everyone probably knows about right now. There's the bath salts. There's all this other lingo out there that you need to educate yourself so you know what to look for when you're looking on their computer or their tablet or their phone. In addition to that, there's also, look at their change of behavior. Are they more angry? Are they reclusive? Are they withdrawing? Are they changing their friends? A change in behavior, yes, some of that's normal for teenagers, but when it goes over that next line, your gut's going to tell you, trust your gut. Something's wrong, and you're going to know it. Follow your gut. I would also look at, whether or not they have different interests. For a while, my son all of a sudden started going to hookah bars. This is a kid who didn't smoke. What's he doing going to hookah bars? And that was to hang out with his friends, who we would then go to their places, and they would do the drugs together. But we thought he was at a hookah bar. That was stupid on our part. We never should have allowed that. Obviously, and then another thing is, just simple alcohol use and marijuana use, I really recommend a zero tolerance policy. And I know for some of you, you're going to say, how unrealistic are you? The brain is very different for our kids, and we have the science now that we know that it's different. The younger they start with alcohol, the more likely is they're going to become an alcoholic. Marijuana has an absolute impact on their brain. There's the science behind it. Unfortunately, we don't always get out the word on the other side of what NORML's proposing out there. But there is an absolute impact. And every kid, almost every kid, I would say 99.9% of those addicts out there, all at one time were using marijuana. If there was something out there that you knew caused cancer in your kid, 99.9% of the time, would you ever find it acceptable for them to use it? I say not, and you should have the same exact attitude towards marijuana. Now, in terms of prevention, know the risks. If your child has, emotional problems in terms of, and normal things, like if they socially have anxiety that way, or if they have self-esteem issues, or even more important, ADD, you'd be surprised, or bipolar, any kind of thing where their self-esteem is at issue, that is a risk factor. Not every kid is going to go down that road, even to use or addiction, but it is a risk factor. And with this, I want to give you a piece of advice. Do not assume that the doctor or therapist knows about addiction. Not every doctor or therapist does, and they may go down that road and prescribe medications that only perpetuate an addiction or even create an addiction. I know several parents where this has happened to them. Be a parent. You have to be a parent. You can't be their friend. If you want to prevent this, you want them to have the best outcome in life, and not just for drugs, for anything. Be their parent. Set limits. You have to have a curfew. You cannot stay out all night. I need to know where you are. I call the parents where you are. I'm going to have an agreement with the parents where you go that there's no alcohol there. There will be a parent there at all times. Check up. Always verify. Consequences. Let the consequences happen. If they miss, and it applies to anything, not just drugs. So if they're going to fail a class or if they're going to fail a test because they didn't do their work or because they didn't do their homework, let them do it. Let them see that it's okay to fail. Imagine what pressure you would be under if you thought you could never fail. What is that? We put so much pressure on our kids that you can never fail nowadays. And I think that creates a risk factor too for substance abuse because they have to take something off. They feel like they've got to take that pressure off, and so they use alcohol or drugs to take that pressure off. It's okay to fail, guys. It's okay. Let them know that. Consequences in terms of legal consequences. If, God forbid, they get caught with drugs or alcohol, let those consequences flow. Let them know that there are consequences for what they do. So, for example, I'll tell you my mistake. Our son got caught. We immediately put him into a treatment program. We hired a lawyer. The lawyer said, oh, well, he's in treatment. No, we don't want to put a legal requirement for him to go into continuing treatment. We don't want to do that. Okay, fine, we won't do that. Biggest mistake. The minute the legal requirement was lifted, he went right back to use. And what did he go back to using? No, not alcohol or marijuana. It would progress to cocaine. He almost overdosed. Know the friends of your children. Know their parents. Every parent has a different philosophy on what is going to go on in their house. So you should know that they are in the same mindset as you. Be a good role model. Don't get drunk in front of your kids. I mean, that should go without saying, but I see it happen a lot. And I'd have to say that if you want your kids to know that you can have fun being sober, you need to set that same example for them. Educate them. If you think that the schools are educating them about this, you're not. Because I put on a seminar for 40-plus kids last year, and I did it in conjunction with Karen. And we showed them the effects on the brain. We didn't use scare tactics, because that doesn't work. We showed them what happens to your brain. The response afterwards was incredible. We also had Officer Fulton there, too. They came up to me and they said they never had anything like that in school. It was so much more, it had so much more impact on them. Bring them to things like this where they can hear about what happens to kids when they start going down that road. That you start out thinking it's just going to be one marijuana cigarette, marijuana here and there, and all of a sudden now some of the kids ended up doing heroin. Or you think you're going to have one Xanax pill, and before it goes that, prescription drugs become heroin. And we have a huge problem in this area. Resources, what do you do if, God forbid, you suspect or your child is an addict? Again, the schools are kind of lacking there, and it's not their fault. You know, they only have limited resources. So my biggest suggestion is go to drugfree.com, SAMHSA, call UPC, call Karen, call Hazelton. You don't have to go to Karen or Hazelton or even Father Martin's to get help. They can give you resources in the area. They are all very knowledgeable, and they will give you the best people for your particular child. Every child is different. Every child needs different treatment. You want to get the best care you can for your child as soon as possible. Don't be in denial. Don't think we can let it go. Please, as soon as you find out about it, nip it in the bud. Get into a support group. There's numerous support groups out there that's going to help you take care of yourself, and it's going to teach you everything that you don't know. So Nar-Anon, Al-Anon, the Karen Parent Support Group that I'm involved in. There's other parent support groups out there too. There's flyers on the table. Do something, because you need to take care of yourself too. Don't forget that. You didn't cause it, you can't control it, and you can't cure it. Take care of yourself and be mindful of that. And don't be ashamed. It's not your fault. It's a disease. You can't blame your child for getting cancer or diabetes or anything like that. You can't blame your child. You can't blame yourself for your child becoming an addict. So take care of yourself. Put on the oxygen mask first for yourself, and then take care of your family. Thank you.
I'm actually going to stay right here at the table. I'm old. If I stand too long, my legs quiver. So my name is Bill Fulton. I'm a police officer, obviously, with the Fairfax County Police Department. Part of my job with the agency is overseeing the school resource officers. Each middle and high school in Fairfax County has a full-time police officer. And I oversee actually the officers on the west end of the county. I actually was a police officer in the school back in 1995. Quite a few of my assignments throughout my career have revolved around dealing with juveniles. So I was a narcotics supervisor. I dealt with the subculture of juveniles in the narcotics arena. You know, I actually watched firsthand students from high school that I worked at evolve and become deeply involved in a narcotic subculture to ultimately committing homicide. In fact, one of them's in prison right now for capital murder. So I've seen it, you know, from the recreational use to the more substantial, devastating use, to the obviously the travesties that come from the worst of it, which would be death. You know, whether it be suicide, homicide, or whatever it may be. But moral of the story is, you know, the purpose why we're here tonight is to try and get people to, you know, hear what we have to say, but take something away from it that could be useful. And we can all talk about what's happened, but let's take what's happened and turn it into how can we change, you know, what's in front of us. So, you know, the police officers are in the schools for a multitude of reasons, and the main reasons, they're there to help the kids and the staff. You know, one, for safety reasons. Obviously, you know, there's a lot of violence in the schools, you know, across the country, and has been for the last, you know, decade. So we're there to keep everybody safe if you know, an issue was to arise. But they're there to educate. They're mentors to these kids and to the staff members. They're available to answer, you know, questions to them. They watch these kids evolve, you know, through the course of their tenure, 4 years in high school or 2 years in junior high school, and they see it coming. Sometimes they see the change. They see the kids, you know, that were the athletes or that had, you know, focus, that had goals, that were in class on time, that came to school. That you can start to see the evolution of who they choose to associate with and what they become more interested in and what they become dependent on. You know, the thing I always tell parents also is teachers are an outstanding resource. They spend a lot of time with the kids, and they watch it too. They watch the grades go down. They watch the kids sleep in class. They watch the interests go from interested to lack of. You know, so they're a great resource to go to. You know, when you're having that first fall meeting or whatever, back to school night, you know, let me know if you see any changes in my kid, you know, because this is a crucial time for them, and there's a lot of exposure to things that may not be so good for them, or they may be the ones impacting other kids. So that's a good suggestion. The school resource officers are obviously somebody you can go to at any time for help. You know, they should be somewhat aware of, hopefully highly aware of the culture of the school. and who's involved in what, who they need to keep their eye on. Obviously, they're not going to divulge information about juveniles' records or history or anything of the sort, but they have their ideas of who they need to be monitoring, and try and work with those kids. Try and get to them before something tragic happens, before they get arrested, etc. The position of being an SRO is not a statistically driven position. It's not about making arrests, and you're not doing your job if kids don't go to juvenile detention or to jail. That's about getting in front of it and that not happening. So we have a lot of programs in place, within the courts, within the school system, as far as trying to educate and open eyes. Obviously, there's an accountability factor that you have to put out there. If you are involved in drugs and alcohol and so on, the schools, carrot that they have to dangle for kids that want to be involved in sports is, we have an expectation. If you don't meet it, you can't participate. They have to start somewhere with their efforts to try and keep kids in line. So with the officers, they'll go into the classrooms, they'll talk to the students, they'll talk to them about the different drugs, they'll talk about the dangers of the drugs. Unfortunately, there's a lot of synthetic drugs out there, and the kids are under the impression they're not dangerous, because it's new, it's in a great little package. It looks like, trading cards or Pop Rocks from when I was a kid, nice cellophane or tinfoil-y looking packages with colors. And the individuals that make these products, they make them for a purpose. They want to draw the attentions of kids. They want to make them look innocent. So we've had the dealings with Spice and with K2 and with the highly caffeinated drinks. And if you look at all of them, they're not for old folks. They draw the attention of the young kids. In the age of the internet, obviously kids can access information instantly. If they want to learn how to make methamphetamine, it's on the internet. If they want to learn, what Molly is, it's there. If they want to order some of this stuff off the internet, it's there. So when we were talking before, and Lori was talking about looking at your kids' computers and their electronic devices, it takes an act of God sometimes to pry it out of their hands. But it is, at the end of the day, and I would imagine, this is a common factor, it is probably your account that their phones are active on. Sometime it gets awkward, I guess. At some point you have to stand your ground and decide, what battle you're willing to fight. And if you're starting to have concerns over your children and who they're hanging out with, and their demeanor's changed, and you're concerned that this isn't the kid from 3 months ago, then you got to put your foot down as a parent, and start holding them accountable, and use the school resource officer as an option. Go to them and say, look, and you're not going to be putting your kid in a vulnerable position. The officer's not going to start following your kid 24/7 and try and catch them because you've led us to believe that they may be involved in something illegal. We don't have time for that. But we do have time to give you information and to talk to you about the options. Here are some of the options that we can help you with. And some of them are not comfortable options. I've been there, done that, as a police officer, as a parent, etc. So some of them are uncomfortable. This topic is obviously not a real comfortable topic. That everybody wants to just gather around and celebrate. It's a fact of life that we're dealing with here, and it's how do we cause it, to take a turn for the better. The resources that are in this county, we're fortunate, between the school system, the police department, and all the other entities. Dave's going to talk here in a minute. We are not a small rural county where you don't have access and you got to drive hours to get to, a facility or a doctor or, somebody with some level of expertise to talk to you about the mental health issues, the implications of drug usage, etc. Even your own primary care physician, around here can give you some foundation of where to go or how to start. What we ask, I guess why I'm here tonight is, use the school resource officers. They're a great, tool for you. And if it's not for you, for someone else. If your neighbor's having issues with their kid, or if you're seeing things that you're suspicious or concerned about in your neighborhoods, cars parked in cul-de-sacs, water bottles, full of brown water at the bottom with holes poked in them, laying in the grass at the entrance to the neighborhood because the kids are tossing them before they get home, call the police. All we can usually, one of our best, I guess, resources is information, and the best information comes from the person that's least expecting, the neighbor who they didn't think would call. Us driving around in a uniform and a marked cruiser makes it a little bit more challenging, to be subdued, and for them not to be looking for us, obviously, to avoid interacting with us. But, our biggest source of information is people calling in on the little stuff. The car where it shouldn't be, the party next door at the house, and they know the parents are out of town, but they don't want to be that neighbor. And I don't want to get in the middle of it. I don't want to, I don't want to meg in my house or cause me heartache because I called. Obviously, you can remain anonymous. We take information seriously. If we start hearing about drug issues, we do take that information and pass it on to our narcotics section. They will look into houses of concern, areas of concern. We will increase patrol with officers, having them go through those areas more often to try and deter that type of behavior or make it less desirable for them to choose that location. So we do have success with the passing on of information. Does it always turn into a flourishing, we stop this problem, right away? Not always, but, we have to start somewhere. Like I said, I've been with this group for 8 years and done quite a few presentations, and I've had formed some relationships with kids that are involved in this behavior, of using drugs and watching their lives deteriorate, and having to hear their stories and having to sit with the parents who've lost their children, like I said, I appreciate people taking their time to come out, for you guys to come out tonight, and Principal Goldfarb for having us here. It's got to start somewhere. We can all put our head in the sand and act as if it's not us, not our problem. I guarantee you, pretty much everybody in this room, if you haven't been impacted directly, you've got family members or family members with kids or neighbors with kids, etc., who have had an experience or an unfortunate, issue with addiction, whether it be alcohol or an illegal substance. Thank you for being here. I'm available. You can go to the Fairfax County Police website, and there's every phone number under the sun. Call any of them and just ask for my name, they'll get to me. And I'd be more than happy to help you myself. If you have issues or concerns or something you want to pass on, you don't know where to start, like I said, it takes somebody to pick the phone up. And we've had issues in the past where I'm sure, somebody knew something and they didn't say something and they probably regretted it after the fact. So, thanks for your time. Thanks for being here, and hope you get something from it. Thank you.
Hi, my name's David Edleman. I'm a supervisor of the Community Service Board and Substance Abuse Services. So now that we've talked about the consequences of addiction, I also want to talk a little bit about, as I go in my presentation, on how to get help. First of all, Lori already touched on the subject, but health professionals understand addiction as a brain disease now, as a compulsive behavior that people cannot control. Not as an issue of willpower or a moral issue, but as an issue of health. Certainly we know in our culture now that the two big drugs of choice, even though we hear so much about other ones, are alcohol and marijuana still. And we hear how much that is in the schools. So parents are left with the quandary, is my child having a problem, or is it just kind of what everybody's doing at high school? All right. And I'm going to go over some signs and symptoms to kind of look for, but ultimately what I would think is that it is helpful to seek professional help to kind of sort that out. If you're beginning to get worried, I would suggest that you seek professional help to figure it out. At my agency, like most people that do substance abuse, we do drug testing, but I find that when we do assessments, it's following the signs and symptoms that are really going to lead you to know whether the person is in trouble. And there's a couple of them that are easy to understand. Like if your student has been having pretty good grades and they're their grades tank and they're flatlining and they suddenly have very poor grades. If suddenly their attendance is odd and they're always missing 7th period or a lot of unexcused absences. If they're sneaking out of the house late at night. If you're just noticing a lot of lying and diverting or going away from the truth, or are not willing to tell you who their friends are, where they're going. Many of these things. And then what I've heard from a lot of parents, like Lori and some of the other people with children in recovery, is that your child's personality just really changes. You're just like, who is this person? I mean, I've been living with them for 10 or 15 years or plus, and then what happened to their personality? I mean, drugs really change a person's personality. The depressants cause depression. The stimulants will cause other erratic behavior. And I mean, you know your child well, so if you see these large personality swings, this should be a key to you to look for more answers. In terms of this, Jen has been kind enough to put the chart out over there for us. And by the way, I forgot to point out at the beginning of my presentation, I have a handout. There's some more behind me. I'm going through my presentation pretty quickly, but this will be a very quick sheet of resources or something like that for yourself or your friends, possibly maybe you're not worried about your child, but you're worried about your friend's child. This will help you with some resources. In the Fairfax County Youth Survey, they talk about risky behaviors, but they also talk about the protective factors that will help children stave off the risk factors that we want to stay them out of, like bullying, drugs, early sexual behavior. And these protective factors are having parents available to help, having high personal integrity, performing community service, having teachers recognize good work, having community adults to talk to and listen to, participating in an extracurricular activity. And as you can see on the chart, as for the different risk factors, we call it 3 to succeed. If you have 3 or more of these protective factors, your risk in these risky behaviors that we are trying to prevent is reduced significantly by half or more. And as you can see, as the more protective factors you go down, I mean, if you go down to 6 protective factors, I mean, your risks are very low. The youth survey, where I provide the link on the handout, will tell you a lot about the percentages and issues about risk. I want to now talk a little bit about seeking treatment and some of the issues about seeking treatment when you think that your child or somebody in your community has a problem. First of all, you're going to experience resistance and denial from the person who has experienced the substance abuse problem. They're probably enjoying using their drugs, so when you reach out to help them, they are not going to immediately be thankful. They're going to push back. But you should continue, based on your experience, to seek treatment for them and to seek services for them despite their pushback. We use the principle of least restrictive environment. It's the same thing for special education. We want to put them in the environment that is the least intrusive to their things. There's generally 3 levels of treatment that you think of, which is outpatient, where you go to a therapist, day treatment, where you go there daily, and residential, or as you might have seen on TV, celebrity rehab. That gets a lot of play in the press, but the majority of people, start out in outpatient. The average time that somebody, when they become addicted, so that is when they become chemically dependent or they have a severe problem, the average number of treatment episodes is 3 before they reach sobriety. So you cannot, necessarily give up just because the first episode doesn't work. And I do encourage people to intervene early rather than later, because like in any disease, such as diabetes, cancer, whatever we're talking about, an early intervention has a greater chance of success than a later intervention. There's the issue of, there's sometimes the issue, particularly with young people, of sobriety versus harm reduction. There's some debate about that, but I think that even if we can't get the young person totally clean and sober for their youth, that means sobriety means, no use of any drugs or alcohol or mood-altering substances. Reducing their use is a useful thing because we now know that the human brain doesn't finish developing until the age of 25. If we can slow them down and give that brain a chance to develop, I think we're giving a better chance of them not developing a serious problem lifelong. Also mentioned before is what we call co-occurring disorders. Often what we'll see is a mental health disorder that is pre the initial substance abuse use. Depression is very common, ADHD is very common, and anxiety. I see a lot of those three will, precursor the initial use. What we call it is people will start to self-medicate or trying to rather than getting professional help, try to medicate their problem with a drug that they seem to think works for them. You have the 12-step community, Alcoholics Anonymous, Narcotics Anonymous out there that can help you at no cost, and I often recommend it to people who are addicted as a support network outside of treatment. I give a few resources. I give you a sheet of resources on the resources that are at the Community Service Board. I give you my number. I think you should call us or one of the sites if you have a question. I field many telephone calls from administrators and parents asking like, well, I have this, I see these symptoms, I see this. Do you think my child has a problem? Do you think my child needs an assessment or not? And we will always, always be happy to answer your questions. Thank you.
Okay, I'd like to take just a few moments to highlight some of the key points that each of our speakers talked about this evening. Lori, you did a great job talking about what I say is be that parent. Be that parent that walks your child to the door. Introduce yourself to the friends, parents. I told a story recently at homecoming. The mother had to get out of bed. I had to talk to her. And after talking to her, I didn't feel comfortable with the plans for the evening. And so the plans changed right there on the step. And that's okay. Be okay to change the plan. Be okay to ask the hard questions. These sometimes are uncomfortable questions to ask, but these are questions that you need to know the answers of when you're going to entrust your child with somebody else. Get their contact information. What's their cell phone number? What's their home telephone number? Is there another adult that's going to be having contact with your child? What's their contact information? All of those pieces can be really important if something were to happen later on. Spot check your children's devices, social media. Know how to work around social media. If you don't know Instagram, you need to. That's where so many of the kids are communicating. Snapchat, Vine, you name it. There's probably something else different tonight. But certainly Instagram, you need to know what kind of messages are going back and forth, what the capabilities are. Facebook is still used, but not quite as much. Bill, I think that you mentioned about prying the phones or the devices out of your children's hands. You could also just set a precedent. Where are those phones, devices charged? Are they charged in your room? Well, there's an opportunity. There's no fight. If your child knows that every single night those devices come into your room at 9 p.m. or 10 p.m., which isn't a bad practice anyway, so that way they can get some sleep. That's an opportunity for you to just spot check. Check what's going on. Know those friends. And just knowing that it's Johnny who lives in such and such a neighborhood, that's not enough. What's Johnny's name? What are the parents' names? What's their address? It's not enough to just say it's Johnny. I, as an intake officer, I take many cases, many runaway cases, where they'll say, well, I think that she's with Johnny. Okay, well, what's Johnny's last name? I don't know, but he's about 6 feet tall. Not enough. We need more information than that in order to turn it over to the police department and work with them to try to bring that child home. I use the term in the village. is a parent in your village or out of your village? You know. That's that gut instinct. You know immediately whether or not a parent shares the same vision, values as you. If they don't, that's okay, but they're not in my village. And I don't have to be in theirs, because I'm probably high maintenance for a lot of parents because I ask too many questions and I expect the answers. So that's okay. You just have to choose who's in your village. If you have to come in contact with an intake officer, police officer, alcohol and drug services, please tell us the truth. It's vital, because oftentimes parents, and I understand this as a parent, are still in protective mode, so they don't want to tell us the whole truth. They'll only give us a little nugget, and the whole truth is what we really need to help your child. So please keep that in mind when you come and access services from one of us, because we can all work with you and your child, and we will do a much better job of meeting the needs of your child if you tell us the truth. We don't have that crystal ball in front of us to let us know what the real truth is. We talked a little bit about internet sales. I have seen an increase in LSD cases that the parents have found out that it was an internet sale. Initially, we thought that some of those cases weren't going to come back positive, but they have come back positive from the state lab that it was in fact LSD. I also had a case where the young man had ordered a very large amount of diet pills, and the parents were perplexed when they came into my office, and I thought, this just does not add up to me. I mean, this young man doesn't seem like somebody who needs to be on a diet. It's a little bit unusual, especially for a male. And so when I interviewed him, I said, what were you really going to use him for? And he was like, well, what do you mean? And I said, well, it just doesn't add up for me. And he said, oh, well, I was going to make meth. Okay. We're going in a completely different direction now. The parents, of course, I had to deliver that message to the parents that this wasn't a diet issue. This was a methamphetamine issue. That's a completely different direction that we had to go. So don't take things at face value. Ask additional questions. And if you don't know the questions to ask, that's okay. As parents, we don't know all of the questions to ask, but find a professional, and all of us can partner with you. And maybe between all of us, we'll ask the question that might really get to the root cause of what's going on with your child. When we first started this 6 years ago, one of the gentlemen who sits on this panel was fortunate enough to meet his daughter, who was part of that heroin ring. But she told us, she said to me, you know, everybody talks about stranger danger, and drugs were the most dangerous stranger I ever met. And I really thought about that. She said, you know, everybody talks to little kids about strangers, but they don't really talk about drugs. And so I took that information home to my daughter, who at the time was in 3rd grade, and I said to her, honey, what do you know about drugs? And she said, well, there are good drugs and bad drugs. I thought, where is this going? And she said, for example, she said, you know, I had to have steroids when I had pneumonia, but Mandy Ramirez shouldn't be using steroids. I thought, Mandy Ramirez shouldn't be using steroids, you're right. But had we not started that conversation when she was in 3rd grade, and I'm grateful to Anna who brought that to my attention, now it's just a natural conversation. Yes, I get the eye rolls, but like any other parent, but it's an important conversation to have. As far as my role as an intake officer, I take the charges from the police officers. So we function just like the magistrates do in the adult system. And so one of the most important pieces of our job is, one, we have to decide probable cause. Is there reason to believe that this young person committed this offense? But the more important piece of my job is, how are we going to handle this case? And I will tell you that we divert a lot of first-time offenders out of our court system, and we assign them to services such as the alcohol and drug services. So we really do a lot of work on the front end to determine how we can help this youth. It's not just about putting them in the juvenile detention center. It's actually quite the opposite. When I first started working for Fairfax County in 1996, we had 55 beds in our juvenile detention center. We expanded to 121 beds shortly thereafter. And today, we usually run between 35 and 45 youth at that facility. So that statistic right there should show you that the pendulum has swung, and we are really trying to treat the youth in our communities rather than in the juvenile detention center. So we too subscribe to the least restrictive, just as David explained that Alcohol and Drug Services also does the same. I'd like to take a few minutes to see if any of you have any questions in the audience for me.
Paula, can I add two things quick? One thing we didn't really focus on, which I think is crucial, is prescription medication. There's a lot of abuse of prescription medication in the homes of, innocently, I should say, sometimes also, where parents or the children get medication, whether it be, after a dental procedure, or whatever, and it gets left in a medicine cabinet and forgotten about, and we don't know how many tablets are in the bottle, or if the bottle's still there, it's gone. And it may not necessarily be your own family that you need to worry about. It could be friends of your kids coming into the house, go to use the bathroom, they open the medicine cabinet, and there it is. They have access to it. So any medications you're no longer using, get rid of them. And they have take-back programs through the police department. If you go to your pharmacies, you can get rid of those and get them out of your house. And the other component is if your kids, your own children, your own family members take medications, especially kids, don't let them be the ones that medicate themselves. Don't hand them the bottle and say, keep it in your bathroom and take them when you take them. And start being aware of if, hey, my bottle fell, the pills fell in the toilet, I need to get a refill, or you go check the bottle and nobody's taking the medication. Keep on top of those things. I think we take it for granted because it's prescribed by a doctor. The kids think, my doctor gave it to me, it's all good. And then we find out some of it's coming to school, they're selling it to friends, they're taking too much of the medication, etc. So keep your eye on that. And then the other thing I was going to say that, in hearing all of us talk is avoidance. Avoidance is one of the bigger key things to look for. Your kid who used to walk in the door and come talk to you at the kitchen table and come sit with you on the couch and communicate with you now goes straight up the stairs. And they stay in that room till they come down in the morning and they go right out the door. That's a huge sign. When they don't want to be around you, they don't want to be around you for a reason because they know you can tell. They know that you'll sense there's a change. With your kid. You're not the same kid from, last year, a couple weeks ago or whatever. So getting your kids in their space, when they come home, get out of bed and go down and approach them and talk to them. How were you? What was your night like? Do I smell alcohol? Do I see a change in their demeanor? Don't let them have free rein to come and go without having you as the gatekeeper and having to spend time with you and be around you. So that's it.
I wanted to say one thing about the prescription drugs too, is you probably read in the paper that we've got a lot of heroin overdoses here, and that really is not from kids saying I want to shoot up with heroin. It's an anathema to most people, to most kids. No one goes straight to heroin. They start usually in this area. Their kids are listening to us. They're not, most of them are very smart. They don't want to do the illegal drugs. They don't want to do anything like that. So what do they start with? They start with the prescription drugs, the painkillers, the Xanax, those things. And when they get too expensive or they can't get another prescription refill or something like that, that's when they're progressing to heroin. So that's what's going on in this area, at least based on my knowledge. So one more point about prescription drugs. Lock them up, including cough medicine.
For information regarding mental health issues, FCPS has listed resources on its webpage. Go to fcps.edu and search Mental Health Resources. There you'll find links for information about mental health, links for FCPS psychologists, community resources, and emergency services information. For more information about the Community Keynotes series, please visit the Fairfax Network website at www.fcps.edu/FairfaxNetwork. For more information about the Unified Prevention Coalition of Fairfax County, please visit www.unifiedpreventioncoalition.org.
Want to learn more about Fairfax County Public Schools? The FCPS News Hour is a news and information program that highlights instructional excellence as well as important school initiatives and events. There are hundreds of videos available online.